Hello, everyone, and welcome to this week's Core Balance Coaching. There is no specific topic today. I'm showing up today for the students to answer questions, and as usual, we have a bunch of questions lined up from students over the past week who posted in the Student Hub. So I'm going to be getting to those, and just want to share that I've had some family stuff come up this week, and that's kind of where the focus of my mind has been. So that's why there's no topic. I haven't really been focused on, creating a topic or planning a presentation this week. But I do want to share that I've been reminded of some times in my past, some tough times, and it allowed me to go to revisit a place that I was for a long time when I was experiencing chronic lower back pain, and so it was interesting because it has been a long time since I've felt that way. It has been a long time since I was really struggling with my back, and it's easy to forget. Time is really powerful. It's very healing, and I think that it's been good for me to be able to go back to a place in my mind where I spent many years. I spent over the period of a decade. There were some dark years where I struggled with my back, and I didn't know if I was going to be able to get better. And so I wanted to just share a little bit of insight with you about that, because some of you may be there right now. And, I'm always trying to connect with people on this journey and to be able to help people. And I can't always be in the shoes that I was once in because like I said, it's been a decade of just continually getting better, and I've forgotten some things. So during this time when I've been dealing with some things and in the family, and just remembering back to what I felt like when I was going through my hardest times, I want to share a bit of that story right now. So the first thing is, it would be easy for me to just say, yeah, like my back pain started when I was 16 years old, and I was on the basketball court, and to talk about how I got taken out of practice, and I couldn't get up off the ground, and I could talk about how I think I created muscle imbalances in my body because I was lifting bodybuilding at a really young age. But those aren't really the things I want to talk about. Someday I'll share my story about how it all started, and the physical details of my back pain, and even the success part of it, of how I got better. But really what I want to share today is about the times when the years that I was unable to enjoy watching a movie because I couldn't stop thinking about my back. I couldn't sit through an entire football game or basketball game because it was too uncomfortable. And even if I did watch a football game or a movie, I wasn't really watching because I wasn't able to pay attention. My mind was so focused on my pain that I just had a recurring, like a record player of my back hurts, my back hurts, my back hurts. I have back problems. I have back problems. I have back problems going on in my mind for the the majority of any thing that I was trying to do. And those were some tough times. And it's hard not to focus on your problem when you have a problem like that. And I think that I just want to share that I've been there, and that you can actually get out of that. I think that one of the biggest worries that I had when I was going through my worst struggles with back pain was that if I was ever going to be able to get better. And I was really young, I'd call my low point, my rock bottom years were the ages of 24 and 25. So to be that young and have worries of being able to get back to a normal life, that's kind of a big deal, because you haven't really lived the majority of your life yet. And so, I just remember, laying in bed or laying on the floor of my bedroom, I can remember just thinking about my back. And so what this brings up in me is that when you have chronic back pain and back problems that are persistent, it actually becomes, whether or not the cause is mental or psychological, it actually becomes a mental problem and a psychological problem, and you have to deal with it. And that's going to be part of the solution. And I would say that largely, in my experience, and even in the experience with students, that, I think that back pain, chronic back pain, and the solution to back pain is 90% mental, regardless of the cause. And you can even relate that to the program of core balance training. If you really think about it, 90% of the things that we're doing and the concepts in the program are mental. It's the focus of your mind. That's one of the most common things that I talk about. And so to be able to shift your focus, I think, one of the turning points in my life happened when I finally decided that I was going to commit my life to healing my back. And I shifted my focus away from my pain and on to finding a solution. It became my new obsession. My old obsession was thinking about my pain and how it was scary and how I didn't know if I was ever going to be able to get better. And my new focus was, it was interesting. Another thing is that this was all happening. I graduated college during the Great Recession, and there was no jobs. Nobody wanted a new grad, and I was trying to figure out my career, and it was like the perfect timing for me to be able to go, well, I guess, there's no way I could do an office job. I can't sit for more than 5 minutes, so that's impossible. And I had to decide my career based on my situation, my back pain. And so I actually said, okay, well, it makes the most sense to just dedicate and commit my entire life to solving this problem and then helping other people to do that. And so that shift in focus was a big deal. And I think that I can share a couple of insights that really helped me, some little turning points that happened along the way. So one of the things was a mentor of mine talked to me about learning to live with the pain. And that I remember being a really powerful shift, because this mentor had knee problems, and he had a terrible infection in his knee, and it ate away at all the cartilage, and there was really no hope for the knee to get better. Nowadays you have a knee replacement, which is a great thing, but during that time he talked about how he got to a point where he could say, yes, my knee hurts, and that's okay. I accept it, and it feels, I feel pain, but I can continue with my day. And that's a big difference from saying, like in my situation where I spent many years going, my back hurts and I can't do anything, and I'm not focusing on anything except for my back pain, and it's basically paralyzing me. And so the day when I decided, okay, well, this is clearly part of me, and if I can accept that I have back pain and learn to live with it, it allowed me to do things in, parallel with the back pain, and it wasn't paralyzing me. So the interesting thing is that when you accept your pain like that, it almost feels like a surrender. It is a bit of a surrender. And it may feel like you're surrendering to the pain for the rest of your life. Well, now I'm going to have pain for the rest of my life. But that's not what happened for me. I actually was able to, I've gotten to the point where I have become pain-free. And it was the process of accepting my pain that helped allow me to get to that point. I didn't know that I was ever going to find the solution and be able to, apply it to me when I was back in those days. But it allowed me to do more, and it became accepting my pain and learning to live with it and say, okay, yes, I feel pain in my back, and that's okay. Was it only a temporary period of time that I had to do that? And so I share that because I do believe that the majority of chronic back pain is actually more low-level pain, and it's more constant pain, and that kind of thing isn't actually, in most cases, it's not physically debilitating. It's more mentally debilitating. And to be able to make a shift in your mind and to be able to decide that you're okay with the pain can really enable you and empower you to accomplish things in your life, and maybe be able to do things to help yourself more. And there are cases, don't get me wrong, there are cases when back pain can be physically debilitating. Put you, flat on the ground, or not allow you to get out of bed. But typically those are shorter periods of time. Those are acute phases. And the majority of the time is pain that you can function with. But if you mentally are not able to function with it, then it also extends into your physical life, and it makes it so that you physically are unable to function with the pain. And so just sharing that as a little bit of a pivotal moment. Accepting your pain doesn't mean you're going to live with it forever, but it does mean that you can take action steps and shift your focus away from the pain to other things, and be able to do some things in life and also have the pain. So maybe that doesn't resonate for everyone, for a lot of people, but maybe there is someone out there that this resonates with and this will click with. And there's a lot more to my story. There's a lot more realizations that happened along the way. But that's just one of the things that's kind of been on my mind, and was hoping to share with you today. So I'll take a quick look at the chat, and then we'll get into the student questions. And if anything else pops up, I'll be sure to share it with you guys. So let me take a look here. So Colin says, I find myself trying to properly breathe all day, and it seems to have taken a lot of pressure off my probably spine, hopefully, Colin. That'd be awesome. Holly, hi, Dr. Ryan. Hello. Oh, Colin says, sorry, pressure off my low back. Is it okay to be doing this only after 3 days? I was trying to strengthen my back with reverse hypers, back extensions, and dead light with a hip hinge. Thoughts? Okay, yeah, I have a couple thoughts on that. So yeah, it's a good thing, Colin, that it's taking pressure off your low back. Yes, it's okay to do it all day. The breathing is actually a pattern we want to ingrain into just our natural default breathing pattern, to where at a certain point, maybe a year from now, you're not even thinking about how you're breathing, and that's more of just the natural way it's becomes your pattern. But it's going to take a conscious effort to be able to do that, to accomplish that. So you're going to have to be thinking about how you breathe for a long time. Hopefully my stream is working. It looks like it's frozen on my end, but I don't know. Can't really tell. So let me know if my stream is frozen. And if it is, then I'll have to do something. Okay, so, but to the next part of your question, Colin, I was trying to strengthen my back with reverse hypers, back extensions, and dead light. Maybe deadlifts with a hip hinge. Thoughts? That part, oh, okay, thank you, Sherri. That part of your question, Colin, I would say that the reverse hypers and the strengthening of your back is not something that I would prioritize as like something that's going to get you out of back pain this early on in the program. I think that the most important thing right now is to develop a solid connection to the small, deep muscles that support your spine. And then once you can form that connection, then we can do the high intensity stuff. But that high intensity stuff is actually, it could potentially have positive or negative effects if you're not connected to the deeper muscles underneath the ones that perform those high intensity movements. Deadlifts with a hip hinge, I think that's what you're trying to say. Deadlifts with a hip hinge, I'm guessing. That's a good thing. Yeah. And a hip hinge is a huge movement to be able to do. So that would be a good one. The reverse hypers, I don't think I strongly recommend right now. And later, they can come. Hello, Guillermo. Good to see you here. Sherri, thank you for letting me know it's working. Holly, lifting anything with my arms out in front of me will trigger sharp sciatic pain. Okay, yeah, I guess, I don't know, maybe some connection issues are happening, but I'll keep going. And Holly, so even after surgery. So, Holly, you're talking about lifting things. So, yeah, and right now I would suggest carrying things closer to your body. And like, if you have a box, you can like pull it into your chest. And you can actually implement the anchors with something up against your body, like up against the object. Say it was a box, you can anchor off of that. And it's actually a really good way to engage your core while carrying something. But the farther you hold something out, the more of what's called a lever arm, the mechanical torque on your spine occurs. And it's going to have more of an effect. So, keep things close in when you carry them. Stay connected, breathe. The breath can absolutely help decompress I especially focus on breathing when I'm carrying heavy objects. Like that's where I'm most focused on breathing into my back, because it can create that decompression. And and you say even after surgery. So yeah, surgery is, there's many different types of surgery, but in general, Surgery can remove a result of a problem, but it can't actually remove the problem. So you have if you have a piece of a disc that needs to be removed, you can remove that, but you can't remove what caused the disc to rupture or something like that. And so it's not surprising to me that even after surgery, this could still be happening. And so that's just the way it is. Oh yeah, okay. So you're a nurse, Holly. You have to roll people. So pushing people really does it for you. That's interesting. I would imagine that pulling would have more of an effect, but pushing, you can really think about the anchors and your core when you're doing that. But I think that if you're a nurse, you are prone to having to lean over a bed, and so it's just not a ideal body position, but body mechanics wise. Yeah, but the breathing, even with people, you're picking up objects, you're picking up people. It's going to be the same thing. People are heavier and more dead weight. I've done that a lot, in physical therapy, just working as a physical therapist in hospitals and skilled nursing, movement. I know exactly what you're talking about. So get help from the CNAs, and you prioritize your body mechanics so that you can keep doing the good work that you're doing. Colin, any supplements I recommend? In general, my nutrition advice is going to be eat more green and eat less grain. So it's like the most simple rule that if you can just generally try to follow, you're going to reduce inflammation in your body. Inflammation is the root of all disease, all injury, all everything. That is the response of the body. And so we can increase inflammation in our body through diet by eating things like sugar, and we can reduce inflammation in our body and allow more healing to take place by eating anti-inflammatory foods, omega-3 containing foods. And generally green food is just a really low inflammation or even anti-inflammation type food. And that the only supplement I take on top of trying to follow that is fish oil. So I actually take cod liver oil, and I definitely notice that it has a really I don't know how to describe it, but I think I can tell when I'm not taking it, and my body feels much lower inflammation when I am taking it. So that's the one I recommend. Okay, so I think I'm caught up in the chat, and we're going to go ahead and get into the slides. So here we go. We have a Student Hub Student of the Week. So first thing is to announce that Sherri Dennis is our Student Hub Student of the Week. And I don't know if that's, I think it's a different Sherri than the one that's here live today. So I just see that the spelling is different. So congratulations to Sherri Dennis. And we're proud of your desire to learn and love hearing about your breakthroughs, aha moments. We would like to honor you by adding 1 month to your membership. We appreciate your participation in the Student Hub. So if you see this, Sherri, you don't have to do anything. We're just going to add a month to your membership, and we're grateful for your participation in the Student Hub and your questions and just sharing about your progress. It's really beneficial to other students, and it offers a lot of insight. And the questions that you ask have been good ones. I think we have one of your questions in the lineup today. And other students can learn from that. So thank you, Sherri. All right, so let's get into our first slide here. So this has 2 questions. They're both on the front anchors, kind of similar questions. So I'm going to go ahead and answer both of them. All right, so the first one from Karen It says, super frustrated at the front anchor lesson 1. One of the most painful positions for me is laying face down. Feels like I am in a back bend. Gymnastics from age 9 to 17. I know it makes no sense to most. Are there any modifications to this exercise? Yes. Yes. I just saw a question coming through in the chat, but I'll go ahead and finish this and then I'll get to your question in the chat, Sherri. So I have a modification for you, Karen. I know that I know what you're talking about, and it makes very good sense to me what's going on. The gymnastics and the spondylolisthesis is going to be, the spondy is going to be exacerbated by anything that resembles backward bending. And for people with a spondy or tight hip flexors or just the general predictable pattern of chronic lower back pain, laying face down in the prone position is going to resemble being in a backward bend for your pelvis and your spine. And so what we can do is we can help block that from happening by providing pillow support. You can put the pillow under your very, very low abdomen. There is a lesson in the program on this. It's called temporary nerve pain relief or temporary pain relief. It's in the extra resources library, I believe module 0. So if you go in there and you open that lesson, I give like specific instructions on where to place the pillow on your low abdomen, and we'll just block your pelvis from tipping forward and block your lumbar spine and potentially the vertebrae that is in the spondylolisthesis from getting pulled forward by being in the prone position. So you might want to find like a really small pillow that can be very specific to that area, and small but thick, and that actually can be an effective way to be able to allow you to lie in that position. So this is really important. I think this could potentially, you may have to experiment with different pillows and different positioning of the pillow, maybe just to find that perfect spot. So it may take a while, but if you can find that sweet spot and that sweet pillow, it could be a really beneficial tool for you until we can get you to be able to lengthen your hip flexors without irritating that segment of your spine. So yeah, just to reiterate, not surprised at all that this front anchor position is exacerbating the problem, and there are things we can do. We want to get what your long-term goal is to be able to get to the point where you can do this, and it may take a long time, but you don't want to go through the rest of your life without being able to straighten your body all the way. And you can do this. I believe a spondy is a very treatable condition. It takes a long time, but there's a strategy you can take. And I did recently talk about this in a video. I'm going to try to remember. I think it was the walking video, my second walking video. So if you do check out that video on the channel, it's walking for stenosis and spondylolisthesis, and I give a visual example of what's going on, and so maybe the pillow will make more sense for you as a modification. So we're going to go ahead to the next front anchor question from Colette. Front anchor feels hard as a woman because of my breasts. It's hard to feel a connection of my ribs to the floor. I assume if a male put a pillow under his chest while laying face down, it would be the same effect. Okay. Is there a way to feel the front anchors while lying on your back? Okay. So this question, I can answer the question, but I do have another modification that might work for you, Colette. So I would consider putting a pillow, like if you can get I'm going to lower this screen here, get a pillow that will help bring the bottom of your rib cage here to the floor, or bring the floor to you. So under your breasts, you put the pillow here, and potentially like a more like dense pillow, so it's more firm, less squishy, and bring the floor to your front anchors. You hopefully will be able to connect to them in the face down position. And so that would be an idea for you to try as a preferable modification than trying to do the front anchors lying on your back, because we need that floor connection to be able to learn the push away. And so I do believe it is important to be able to lay prone, and the way that we need to do that, if you're having trouble and just in a completely flat position, is do modifications. So just like what I was talking about with Karen up above, modification with a pillow, you might have to try a pillow, or a folded towel is another option. A folded towel is good because it's kind of firm, and you can determine the thickness of how many times you fold it, and just try to bring the floor up to the bottom of your rib cage in the front, so that you can connect these support points to the floor through the folded towel or a pillow. I think a folded towel might be better in your case. So that's what I recommend. If you cannot do that, then we can talk about other alternatives, but I don't think that there's a great way to do the front anchors laying on your back, simply because the ground is going to be blocking you from doing the push away. And so we kind of want the connection on to the anchor. And so that's why I kind of feel that way. All right, so I'm going to go back to the chat real quick and answer Colin's question. Any extra work that we can do in the evenings to help with our backs? Pretty soon, I think you mentioned you're on day 3, Colin. Pretty soon I'm going to start having you do the bridge again right before bed. And we talk about why that's beneficial. And definitely you can get down on the floor again in the evening and run through that whole routine again. And the other thing I really recommend at this stage is walking. Like I really don't, I think there is a risk of doing too much in these early stages in the program, which can kind of distract us away from the real purpose, which is learning this very specific connection to the muscles in our core. And if you start doing too many things, it actually can, and your body starts to react one way or the other. You don't know which of the things that you're doing are the right thing and which of the things that may be hurting you, because there's just too many variables. And so in the very beginning, I think it's important to keep it simple and do a small number of things and listen to your body. And if they're working for you, do more of them. And then we add another thing layer by layer by layer. And that's how the program is designed. So I'm not going to recommend any crazy exercises. That's not what's important right now. Those come later. Those are layers much farther down the line. But something like walking, a natural, healthy movement is good, or just to do another round of the routine. If the things that are feeling good for you, you can do that again at night before bed for sure. Something more in the chat from Sherri. Sorry, I missed your question, Sherri. So, what brand of cod liver oil I buy? I buy Garden of Life. So I think it's a pretty popular brand. I buy it from Sprouts, but you can buy it from any, not any, but lots of stores carry Garden of Life, because I think it's become very popular in the last 5 years. And they have a really good cod liver story. Cod liver oil. And I was just reading your next comment. They said, thank you for sharing part of your story. Yes, I agree. Chronic pain can become a mental struggle as it drags on, especially when you run out of options and seemingly out of hope. Yeah, so that's part of it, is the hope. And if you run out of hope, there's not a lot that you have left. I think the hope is one of the most important ingredients. And you also have you have to have, I think it's important to have some thing or someone to do the work for. Because getting out of the mental cycle of chronic pain and focusing on the pain and focusing on the anxiety associated with never being able to get better is what keeps you there. And it's hard to shift your focus off of that. And so having something to do it for, or someone to do the work of shifting your focus to something else, is important. For me, at that point in time, I didn't have a wife, or I didn't really, I didn't even have a girlfriend. I had my family, but I was out living on my own, and my focus was surfing. So it was a thing, and that was my big drive, was to get at that time, surfing was the love of my life, and I couldn't do it. I was unable to surf for a period of 2 years because of my back. And so I wanted to get surfing back. I wanted to get the love of my life back, and that was my drive. That was my motivation for putting in the work. And that's a big thing, is it takes work. Yeah, you got to do exercises, and that's physical work. But if it's true that 90% of getting better is mental, then it's going to take mental work too. And so focusing on what it is that you're doing it for, and putting in the work to shift your focus from the problem as something that has a hold on your life to the solution, whatever that may be. And in this case, I tried to lay it out for everyone but through the program. So anyway, yeah, thank you for sharing that, Sherri. Colin, makes sense. I always give 100%, so like to know and learn. Thank you for your answers. Yeah, of course, Colin. Yeah, thanks for showing up live. Always try to prioritize people showing up live. So let's go to the next question. I believe I finished. Yes, I did finish the front anchors questions. So going back to the slides, we got a question from Erica. She posted in the Student Hub, I'm just finishing week 2 and definitely noticing some gains as far as feeling taller and loosening some tension in my mid-thoracic area. I haven't had any SI flare-ups since starting, which is a plus. That's great to hear, Erica. Good job. Since starting the front anchors, I've been noticing tension in my right low back muscles. I believe it's my multifidus. I have a hard time totally engaging my pubic bone without squeezing my glutes, but I feel like this also affects the muscles in my low back. I do have a right anterior pelvic tilt. Am I trying too hard? Should I back off? Also, with all of the exercises, it is a real challenge for me to continue to breathe into my low back. I'm wondering if I should help my progress and just focus on that area before progressing to week 3. I think you were meant to say halt my progress. I'm definitely getting benefits from the program, and I appreciate your course. Thank you. Thank you for sharing, Erica. And I do have a couple things to say. So it's just a really good thing that you're observing, you're tuning into your body and feeling what it's telling you. And I think that your intuition is probably correct, as it usually is for students. I've noticed that when students have an intuitive, part of their question is like, do you think I should do this? Like for you, you said, should I back off? I think that's probably a yes to that intuition. Like I have a feeling maybe this is what's going on. The student's intuition is usually right, even more so than I. This is maybe not a smart thing to say on YouTube, but even more can be more accurate than a doctor's opinion about what's going on with the pain and where the pain is, because the person experiencing the pain can feel it and the doctor can't. So he's only going by either imaging or what you tell him or her. The doctor has very limited insight into the feelings, and the feelings provide intuitions. And the intuition, they tend to say trust your intuition because it's usually accurate. So, so that's a yes. And if you can turn down the intensity and get just to the point where you can activate those deeper muscles without engaging the right low back muscles too much, that is the foundation that you want to build on, and then gradually work your way to increase the intensity very gradually over time. And I think that's how the imbalances work their way out of your body. So, it seems like to me, from what you've shared, Erica, that you're making progress. And as usual, progress takes time, and there's going to be just some patience involved. But since you're getting benefits, doing more of the things that are giving you benefits and spending more time and having that patience to allow your body to make the changes and adapt is what I recommend for you. Keep doing what you're doing. The next question you had was if you should halt your progress through the program. That's up to you. I think in the ideal situation, you would halt because there's no rush to get through this. And if the more you can develop confidence with the foundational concepts, such as breathing, back anchor, front anchor, the better everything is going to go. The better the layers are going to be when you put them on top, and the more success you're going to have. But that said, we're going to continue working on breath. Everything that we do in the program, there's a continued focus on breath, and you can actually work on this breathing pattern for the rest of your life. And you can continue to improve on it indefinitely forever. And I'm still working on it and improving my breathing with noticeable benefits and results, many years down the line. And so there's not going to be a point where you get to with breath where you're like, I've reached the end and I'm there and I made it. I'm done with the breath challenge. You want to just think of it as a journey that you continue to improve, just like something like meditation. And so you can continue. It shouldn't be something that stops you from continuing, but definitely also continue to work on the breath while you're doing the new things in the program. So that's ultimately for you to decide, and there's no rush to get through it. I saw something come through in the chat. Let's take a quick look. Mary showing up. Hello, Mary. Good to see you. I'm back and hope to continue do my part. All right. Glad to hear, Mary. Chris Walsh, saw on your recommended book list, Healing Back Pain by John Sarno. Some really interesting theories there, which sound much like today's discussion. Yeah. I didn't even think about that book when I was talking earlier, but yeah, there are definitely some similarities, and what I was trying to share is in alignment with Dr. Sarno, and I thought that book, when I read it, was a big turning point in my journey. I read that book before um, I reached rock bottom with my back. So clearly it wasn't the solution for me, but it was a great insight to just open my mind to the idea that back pain is more than just a physical thing. And it definitely was a turning point, but it wasn't I continued to get worse for some time after reading that book. So I wasn't able to mentally heal my back. I think there is a physical component. But I also think that the mind and the body are intimately connected. They are almost, you could say that they are one. And so there is, I don't think it would be correct to say that back pain is all mental or all physical. It's both. But with the struggle, I think the struggle is really 90% mental. We're experiencing our thoughts in our mind, and the pain is influencing our thoughts. But largely, I think that the debilitation, the physical debilitation, is less common than the mental debilitation. Holly coming through with a question: do you have any tips for my having to stand at work for long hours related to postural scoliosis? I have my, I think I could imagine you standing in front of the med cart, and I think that is going to be a bit of a challenge. I think movement and variety is what I recommend for you. So maybe instead of keeping the cart in one place and doing everything, if you have a bunch to do, but continue to move the cart and move your body and take breaks to walk down the hall. Maybe split up the way instead of bulk processing things, maybe go see patients more often, and potentially just work in more variety, because standing still is the same kind of repetitive trauma as sitting still. The movement is generally more healthy for our body than just like a static position. So that'd be my one tip. Okay, yep, driving tips. Colin, any tips for plantar fasciitis? I'm more of a barefoot guy with wide shoes, but walking all the time does cause my feet to hurt. Definitely, Colin, you got to check out last week's YouTube video we posted on Thursday, all about that. And then tomorrow, every Thursday we post a YouTube video. Tomorrow's is a follow-up on that, and I recommend I go get specific into different shoe brands. But last week was more about my strategy for the feet. And I think that would be directly relevant to you, Colin. So, yeah, good question. So let's go back to the slides. We've got one from, Colin, look at you right here showing up. So, understand sitting on your sit bones, as that's how I've sat for a long time. But the push away you talk about, is that supposed to be your lower spine kind of pushing forward a little bit to sit upright more? It's a little confusing to me. I'm glad you asked this, and I'm glad you're here, Colin, because I'm just going to demonstrate for you. My answer is no to your question. The pushing away is actually pushing down with gravity into the surface that you're sitting on. And so I don't know if I'm going to be able to give you a good view here, but I'll try. So everything that about us trying to learn good posture, at least in my life, was understood to be like up, like taller, sit tall. And actually that can provoke an unhealthy pattern of muscle activation in your lower back muscles, and that's part of the predictable pattern. So what I'm trying to accomplish with this concept is to switch the intention from up to down. So if we can shift our effort from trying to go up and like create space here, which is totally disconnected, and go down, down. All of my energy is going down through my spine into the sit bones, and I push away from the earth, from my seating surface. What happens is I actually come up. I actually grow taller because it's something called ground reaction force. And so we are strengthening our connection to the earth. You said you're a barefoot guy, so hopefully that makes sense to you. We're actually recycling gravity through us by pushing away from the earth. So all of my energy, my shoulders, everything comes down, and I push away. And what happens? The equal and opposite reaction happens. And so I'm pushing away through my sit bones, and I'm not trying to control anything about my spine or how it happens. It's just an intention, and it's just the introduction to this concept of pushing away that we're going to talk a lot more about throughout the program. A lot of this stuff is built off of pushing away, because at the end of the day, that all we have is gravity that we're interacting with. And we have two things. We have our body, and we have the surface that gravity is pulling us into. Usually that's the ground or the floor. Sometimes it's a chair. And so to interact with gravity, with our bodies and the surface, the earth, by pushing away, is mimicking how babies and infants developed, and how we eventually developed perfect posture and movement by the age of 4 without ever having to learn about what a muscle is or how to move a certain muscle or isolate a muscle or what their names are or anything like that. It's just this simple idea of a baby being on the floor and wanting to get up off the floor and be like everyone else. And the way they did that was by pushing away from the floor. And it's a really interesting process of how we developed healthy posture and movement by doing that. So we're just trying to mimic that. Hopefully that answers your question. Let's go on back to the slides. So that was your question, Colin. I hope that helped, and we're going to move on to the next one. I know you're here in the chat, so let me know if that answered your question. So we've got Catherine, I believe. That might be a misspell, or maybe it is not a misspell. Catherine Kelly posted, I've been doing module 1 all last week. I feel fine when I get up off the floor. A few hours later, however, my lower back and area of the sit bones aches. Lower back and sit bones aches. I'm beginning to think it's from the bridge. I try to keep the correct form, but I notice my pelvis begins to get some tension and discomfort when I'm lifted off. I don't even go all the way up in the bridge yet. Do you think this is the reason? Okay. Yeah, I think you're talking about the bridge when you're lifted off and you don't go all the way up. So it's possible that this is the reason, but it's more probable to me, Catherine, that if you are doing the daily routine and you get up off the floor and you're feeling pretty good for a few hours, that you're doing something right. And when we are making change to our body and making progress through the program, sometimes, it doesn't happen like that. Most often what happens is your symptoms reduce in intensity. Sometimes for other people, it's your symptoms can go away for a little bit, but then they creep back because you haven't fully broken out of the pattern or changed the muscular balance of your body yet, but your body communicates to you for a short period of time through reduced symptoms that you're doing something right. And so you do more of it. but you're not completely cured or healed, so the pain does creep back later, and that's a very common thing, and I think it seems like that's what's happening for you. And so if what you're doing is helping, do more of it. And when the pain is coming back, or maybe even it seems like it could be changing for you, that might just be the problem that is existing. But if intuitively you think that there's something about the bridge that is creating a new pain for you, and if say it's worsening your problem, and I don't know if this is the case, then that's when we need to make a change. But at this point right now, from what you're saying, it just seems like the pain goes away for a bit and it doesn't go away forever. And that's not how this process is expected to go for most people. It's usually more of a gradual process, and you'll get to the point where the pain will go away for longer, and you can do more through over time, through the work and through the progressing through listening to your body. So it sounds like you're doing a great job listening to your body, and I would just encourage you to do more and continue to do that. And without seeing you do the bridge, I think that the best thing you can do is keep listening to your body and let that determine how to navigate this. And I'd encourage you to check out the pain FAQ, because I kind of dive deeper into that concept of like, what does it even mean to listen to your body? Of course I can feel my body, I can feel the pain, but listening to your body is actually an active process of looking back in time and reflecting back and connecting what you feel now with what you've done recently. And so that next time you do it, you can have more information and do it in a potentially just continually make small improvements. So hopefully that helps. Let's finish this question and then I'll go back to the chat. So Jeannie, I understand the importance of stretching the hip flexor muscles, but wonder if there is any way to do this that doesn't involve doing the bridge exercise. That's a good question, Jeannie. So the situation is, I already read the lower part where you're having neck pain with the bridge. And so the first thing I want to do, instead of providing you other ways to stretch your hip flexors, I want to offer you a modification for the bridge that should not irritate your neck as long as you can lay on your back. So doing the bridge on an elevated surface. So say you have a staircase available to you, maybe in your home where you live, you live on a two-story place. Maybe you don't, but just hypothetically, if you had a staircase, you could do the bridge at the top of the staircase where your feet are on the second step down and your body is on the top of the staircase, the landing or whatever you want to call it. And so your upper body can lay flat on that landing, and you can still bridge up, and it's not because your feet are lower and you're barely coming off of the floor, and it's not cranking on your neck. It's not providing that pressure on your neck because you have more contact surface with your body. There are other ways. If you don't have a staircase available, we have in the program, we have the bridge on the foam roll modification, which will do the same thing. And you can actually support your head with your hands. So you can check that out. That might be, I'm not sure how far you are into the program, but if you're not there yet, you can just try doing the bridge on the foam roll, and you can try it crossways or long ways and see if either of those work for you. It's the same thing. It's more, your body's elevated, and so there's more excursion happening with less flex in your spine, in your upper back and your neck, less pressure on that. Other ideas are Swiss ball, big exercise ball to bridge on that, or any elevated surface. If you have like a little deck or a little patio or a mattress on the ground or even on the couch. Your body on the elevated surface, your legs on the lower surface. So that would be a better option than, and then the other thing, and just about your question about stretching your hip flexors, I would suggest that stretching the hip flexors just alone as a passive activity is not necessarily something that I recommend right now. I did that for many years. I did that for a decade, trying to help my back problem. And what happens is the hip flexors will just tighten right back up. So yes, there are ways to stretch the hip flexors other than the bridge, but the magic of the bridge is that you are replacing that stretch with some active support with the glutes and the abdominals, and particularly the way that we do the bridge. And so you don't want to just do a passive stretch. You're taking away support for the spine by stretching the hip flexors, and you want to replace it with something else. You don't want to just stretch them out because they're tight for a reason. They're just going to tighten right back up. And I think maybe a lot of people probably can relate to that, the cycle of stretching. And so we're using the bridge to break out of that. And I would encourage you to try the modifications of the bridge before we talk about other alternatives. And that there are some alternatives in the program. And I think that one of them is in Module 3. Or maybe even Module 2. It's the kneeling hip flexor stretch. So it's somewhere in week 2 or 3, and you'll be coming up on it soon. And that's another active stretch involving the push away that you can do as well. So I'll take a look in the chat real quick. Colin, you say, I can kind of feel my body rise with new breathing technique without trying to sit with perfect posture, but I don't think that's what you are talking about. Yeah, the breathing is a foundational concept, and you can get a little bit of rise by sending your breath low. And it is a similar concept. The energy is all going down, right? And if the energy is all going down and the ground is there to stop the energy from going through the floor, you can't get your energy to go through the floor, then you have what's called ground reaction force. It's going to recycle the gravity and the downward energy back up through you. So you're sending your breath down. It makes you taller. You can also just send your energy of your intention. Like, I want, instead of trying to become taller and raise everything up, I'm going to do the opposite. So try doing the opposite, Colin. Try lifting your shoulders up. Okay, down, lower. And you can even think about sinking your sit bones into the chair. And like, I've even heard like a visualization of thinking of yourself as a tree trunk, and your sit bones are roots growing into the surface that you're sitting on. And that's how a tree becomes taller, right? It grows roots down into the ground, and that allows it to become taller. And so that's if you continue to practice it and work on it and trying to wrap your mind around it, I think it will click at a certain point. And the push away concept, it can be applied not only to the sit bones, but to pretty much any circumstance, because we're always interacting with the ground and our body, and we have gravity. That's what we're interacting with. Okay, next one. I believe I answered these two. So we got 4 more slides. So this one is from Pascal. I just did the intro breathing. All right, Colin, here's a breathing question. It made me dizzy. I'm determined to get it though. Okay. Back kicker awareness day 1. It makes me shaky to engage my stomach muscles. It feels like the top of my iliac bones are in the way and force me to rotate my pelvis a little. I have a pressure in my throat when I do it. The pain centralizes around where I have the herniated disc, L3-4, which is good, I suppose. I don't feel any pain in my leg. I am medicated while I do this, so I wonder if that changes my perception of pain, if any. So I can see that there's a lot going on here, Pascal. You have a lot of body awareness, and even in the relation to your throat. You mentioned that you have a pressure in your throat. I would suggest that, when there is a lot going on, I think that one healthy thing to do is to return to the breathing and put your focus on your breathing, because a lot of things, and when you're focusing on so many different things in your body, it is distracting, and pain is very distracting, and it is very worrisome, and it can create feelings of anxiety, which can promote the actual problem of the muscle tension in the protective muscles. And so just returning to your breath, taking a deep breath, and we can talk about that because you said it made you dizzy. So I'm not sure exactly. Dizziness can be caused by a lot of different things. It's actually one of the most common symptoms that people have, and that take people to the doctor. But the number of possible things that can cause it is way beyond the scope of what I deal with here. It can be medication related. It can be dehydration related. It could be hormone related. It can be blood flow, blood pressure. It can be so many different things. And so if the breathing is triggering it, I would just suggest to turn down the intensity and give it a try, just a lower degree of intensity, and see if you can accomplish it with less dizziness. And that would be my best suggestion. And just make sure you're hydrated and taking care of the other things that could potentially cause dizziness. With the back anchor, I do want to say that with the shakiness, that's usually a good sign that the muscles, usually when there's twitching or shakiness, it's a sign that the neuromuscular system is learning. And when you have a nerve connection to muscles that's not very strong, the wiring isn't very good. Sometimes when it's first starting to fire that connection, it's a little bit shaky, and it's learning how to do that again. Maybe it's been a long time, and that's something I've seen. It's actually I've received this question before. It can be like a fasciculating type feeling, and it's usually a good sign. So I just want to give you the confidence that it sounds like you're doing something right, especially that it's in your stomach muscles. That's a very good thing. And just try to turn down the intensity. If you're feeling a lot of pressure in different places, like your iliac bones and your throat and stuff, just try doing it in a more meditative, very low intensity state, and see if you can focus on your breathing and try and simplify the focus of your mind onto those, just breathing and potentially just pushing away. Now, with the centralizing pain, yes, I will confirm that's a good sign. Centralization of pain, it sounds like you're educated about this, is a sign of making positive progress. And the pain extending further away from the source of the pain is the opposite of progress. And so not getting pain in your leg is a very good thing. And so keep up what you're doing. It sounds like there's potential for you to get a lot of benefits from this if after only day 0 or day 1 that you've already experienced some benefit. And this is a long process and a long game. And so I would say the general rule is if you feel something doing good for you and working, to do more of it. Keep the intensity low, but do more frequency of it, more repetition, And things that you feel like are hurting you, do less of those things. And by following that recipe, you can make a lot of progress over time. So, yep. All right, so next one from Jordan, and this is in the Student Hub. Loving the program, been doing it for a couple of weeks, feeling like I'm able to implement the anchors during my day quite a lot. I definitely feel more solid on the lower front anchor than the rib cage anchor, especially without the floor. But just try to focus on the intention. Had an episode with my back 2 days ago that would often put me out completely for a few days to a couple weeks. But I was able to work a full day as a carpenter, being hyper aware of my anchors through my movements. I keep getting the impulse to reach behind my lumbar spine with my arm and pop my back. It feels like it would give some relief. Would you definitely recommend resisting this urge, as it is probably part of the cycle of hypermobility? I think that your intuition is probably right in just the nature of your question, Jordan, that if you feel like there is some hypermobility going on in your lumbar spine, then I would resist the urge to pop it. The urge may be as simple as your body's used to it because you've been doing it for a while, and so like somebody who cracks their knuckles, it's not actually necessary and the body doesn't actually need it or even want it. It's just familiar with it and used to it and expects it. And so if that's the case for you, then stopping doing it will have no negative side effect, no harm to the body, but except that you will have the urge simply because of the reasons stated. Now, if that's not the case, if this isn't something that you've been doing for a while and like this is a new urge that has just arisen recently, and it's not from a habit, then that might be your body communicating to you that it does want some I don't know, extra mobility in that area. So I can't know that because I don't know your body, but I can say that if just from the nature of your question, it seems like you should probably resist the urge, as it's probably not doing anything good for you, especially if you have a hypermobility. Then we want to do the opposite. We want to stabilize that. It's ultimately going to be up to you to determine that. But to make it real simple, if hypermobility or instability, yes, resist. If not, if the urge is your body asking for more mobility in those areas because it's not getting enough, then you can try. I recommend listening to your body. So I have talked about the different types of pops in the past. The one that people get intermittently is from the release of gas in the joints. So if you can't reproduce the pop over and over and over just by doing it, 10 times in a row, then it's most likely the release of gas, and that's typically less of a serious situation than the type of pop that you can reproduce over and over without that time lag for the gas to rebuild up, like cracking your knuckles. You can't just repeatedly crack your knuckle over and over unless you had an instability in the knuckle joint. And that's a bigger problem. So that's the type of one I definitely recommend resisting for pretty much in all situations. So hopefully that helps give you some clarity. Let's see. We've been going for, how long have we been going for? Yeah, my screen is frozen, so hopefully you guys can still see me, but I don't even know how long. We've been going for 1 hour and 15 minutes. Cool. Just by looking at the clock. All right. So next question is from Diane. She says, hi, first, I have to say this program is amazing. I'm in 100% to the best of my self-diagnosis. I have issues with my SI joint, anterior tilt left hip, 1.6 centimeters higher, and I have pain on my left side back, hip, IT band into outside heel, and recently groin and down interior leg as well. I just did Module 4, Day 5, Butt Buster, and I think it's perfect. However, my biggest question is this. Which side is truly weaker? If I'm able to get balance, I need to find the weak side, right? The pain side feels weaker because it's sore and does fatigue faster, but I'm able to activate those muscles easily so it feels stronger. Maybe I'm more in tune with it because it's in pain, or is the other side pulling? You've also said focus on the side that is more difficult. Neither seem to be particularly harder. I feel I have good body awareness, but this confuses me. Really good question, Diane. I can tell that you've been listening and implementing the teachings, so good job on that. And yeah, this is a great question. It's like, which side is the weaker side? It actually feels stronger. I think, I can't be sure about this, but I think that what you need to focus the question is for you is going to be a little more specific. It's not going to be which side is stronger, or the other way is weaker. The other way to ask that would be, is which side is weaker? I think the question you should be asking is, which side has more endurance? And that is the thing that we're really training, because what we want to do is be able to have a good, strong connection to these muscles, not necessarily strength in the muscles, like you could lift hundreds of pounds, but a strong electrical connection that can last continuously for a long period of time. And so that, with the word strong, can become confusing, but I think what's more valuable is the ability to maintain the connection. And that is a question of endurance. And you mentioned that does fatigue faster. There it is right there. So the side in pain does fatigue faster, but you're able to activate those muscles more easily, so it feels stronger. So activating muscle could be as simple as this, right? Oh, wow, that's activation. I'm able to do that. But what if I'm trying to hold something in my hand, but I can only hold it for a couple seconds because I'm able to activate them really well. So I have strong jolts of connection, like a lightning bolt, but I don't have sustained connection. Which one's going to benefit me more in daily life? So that's what's going to be more important to you. What is going to be more applicable? And if a muscle is fatiguing quickly, then it may be able to accomplish certain things, but it won't be able to get you through most life activities that are continuous activities, such as standing or sitting or walking. And so these are low level strength wise, but high level connection wise. So this connection is strong. The ability to maintain the connection is strong. And so this is really kind of specific to your spinal support muscles. The glutes typically are more of a strength power muscle. So they're not really designed to be held in a contracted position for a long period of time. So if you're talking mostly about the glutes, then it's going to be a little different than that. But the focus should be more so on your deep abdominal muscles, deep core muscles, and that does involve some of the deep hip muscles that are involved in the bridge and the butt buster. So endurance is important for the deep hip muscles. There's 6 of them, the P-go-go-Q muscles, and nobody talks about them, but piriformis is one of them. That's the one that everybody knows. But there's a bunch of others. Gemellus inferior, and I'm not going to go through all those, but so yes, endurance is important for hip muscles as well. And let's see, maybe I'm more, your other question is maybe I'm more in tune with it because it's in pain. That is a yes. We're going to be more hyper aware of the parts of our body that are continuing to speak to us. That's electrical activity, right? Is communication, pain signals. And so, yeah, we're going to be more in tune with that. And then or is the other side pulling? So that's another really good question, because oftentimes when you have SI joint pain, the side of the SI joint pain is the opposite side of the hip joint problem. And so there's a lot of crossing happening in the body, and you want to be aware that you may not have a one-sided problem. You may have pain on one side and a problem on another, and so that's where it gets really confusing. Like, which side is weaker? And the muscles above your pelvis on the right side are stronger and tighter, and the muscles below your pelvis on the left side are stronger and tighter. And so that makes it real confusing and hard to know. So at the end of the day, going back to the fundamentals, back to the foundations of back anchor connection, front anchor connections, being able to maintain those connections, and then add very simple layers on top of that. Okay, so we're going to do the, say, front anchors challenge. And my top priority is to stay connected to my anchors. Those are the most foundational components, and of course breathing. And then I'm just going to do the arm and leg movements, and I'll go real slow and see how that it feels from different side to different side. Which side starts to fatigue faster? Okay, that's the side that I need to work on building the endurance more on. But at the foundation of that all is maintaining the connection. So really long, convoluted answer, but really simple solution. Go back to the basics, and if it starts to get too complicated, go back to the basics. Even more basic. And then add the layers and listen to your body and feel the side that you need to work on, and prioritize the endurance of that side. Hopefully that helps. And the last one is from Sherri Dennis. All right, Student Hub Student of the Week. So Sherri says, I have done so well breathing while maintaining core strength during all activities. That's great to hear, Sherri. I just got thrown a curveball. My diaphragm isn't getting electricity because of C2 to C4 issues and not functioning at full capacity. Pulmonologist also noticed that I'm not inflating belly when inhaling and flattening when exhaling. Okay. Okay. I breathe the opposite. I'm now practicing breathing the correct way, and I'm finding it really hard to concentrate on two things at the same time, engaging my core and pushing out the diaphragm belly to inhale. Right now I'm doing the breathing as a separate exercise throughout the day. Any tricks on how to maintain core and push out belly while inhaling at the same time? I tried thinking of it as a push away, but I still can't coordinate breathing and core. So, Sherri, this is a bit of a complex question and answer for me, because the pulmonologist is probably onto something with you and is probably giving you a lot of really good information, but also the pulmonologist may be giving you may have a little bit of a different understanding of what the pulmonologist is trying to relay, or the pulmonologist may be giving you potentially some inaccurate information. And I can't be sure about that. But what I'll try to do is try to clear up the goal. The first thing is you're saying that you're not getting electricity to your diaphragm, and that is an issue. And I don't know if that, I'm looking up right now neurological innervation to the diaphragm, because from what I remember, it's not C2 to C4. The diaphragm is actually elevated or innervated by up higher in the brainstem, C1 to the brainstem. So I'm just looking at it says diaphragm is innervated by the phrenic nerve. Let's look up phrenic nerve. I'm just gonna. I'll show you what I'm doing right now. I'm looking up phrenic nerve innervation. Yeah, C3, C4. Okay. So if you are having C3, C4, 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 and C4 is actually, the spinal nerve should be above the C4 vertebrae. So it's possible that you're having a bit of an innervation issue with your diaphragm from levels C2 to C4. It would be specifically C3 and C4 not functioning at full capacity. So and then there is a name if your pulmonologist is trying to say that your breathing is the opposite. I remember learning about this in PT school, where the stomach actually comes in on the inhale and expands on the exhale. And I'm trying to remember the name. It's almost like inverted breathing or something. Yeah, inverted breathing pattern. So the stomach is doing the opposite of what it should do. And for you, I think that what you may be interpreting, so now I have a little bit of just cleared up some of my questions. So for you, you may be interpreting the core balance training breathing method as do not expand the belly. The belly does not expand on the inhale, but that's actually not the case. With core balance training breathing, we're sending the breath low and we get 360 degrees of expansion on the inhale. So the belly does inhale, the belly does expand. It's just not the only thing that expands. The sides expand, the back expands. We get expansion because the diaphragm, the parachute-like muscle, is pushing pressure down into the lower abdomen. So we get that expansion. And it seems to me like what might be happening with you is your belly is coming in on the inhale and expanding on the exhale. And we did learn about this in PT school. It's a dysfunctional breathing pattern, and that is not in alignment with core balance training. The way in which, I don't know if you're either interpreting your pulmonologist a little differently, or if they're giving you this information that I kind of want to clear up, is that the belly is not the only thing that expands on the inhale. The belly is one thing that expands, but you can also get a little bit of expansion up high in your chest, in your back, and you should get expansion on the inhale. And it doesn't need to be isolated only to the belly. You don't want to just expand your belly on the inhale, because that is actually promoting what I believe is an unhealthy breathing pattern. We want to have a little bit of engagement in the abdominal muscles, even on the expansion. And so we can create this thing called intra-abdominal pressure, which is an incredibly valuable source of spinal stability. And there's tons of research to back this up. So yes, belly expansion, but no, belly is not, you're not just extending your belly out and in on the inhale and exhale. You can get expansion and more uniform expansion throughout your lower body, and even a little bit up into the chest and the back. So if it is an innervation problem, then this sounds like the root of the problem is actually in the neck, because those nerves are compromised as they exit the cervical spine. And so it may be a little bit out of your control to just change your breathing pattern because those nerves aren't functioning properly. And that isn't the situation where I would try to address the root of the problem, which is what's going on with the neck and the neck muscles. And can we get some decompression off of those nerves through a healthy way? I'm not suggesting surgery or anything like that. Those are decisions for you to decide, but through posture and creating muscular balance in the muscles that support the neck to help create some space between those vertebrae. So that's kind of like what I can say about that. It seems like could be multiple issues going on, but definitely just want to clear up that you don't want to just exclusively push out your belly on the inhale. You want to get expansion through an active inhale with a little bit of tension in your abdominals, get expansion in your belly and your sides and your back, and that's okay. That's a very good thing. So it looks like I didn't go to full screen for the last slide, but that was the slide there from Sherri Dennis, or maybe I did, but we're back to full screen with me. And that's it for today. So looks like we went an hour and a half today. I don't know if anybody's still here. Oh yeah, we still got a few people here. So hey, thank you guys for being here live. And I don't see any more questions in the chat. So that's today, mostly just for students. Shared a little bit of my story, and someday I will share more of the story. It's a long one, so it'll probably be hard to pack into one stream, but it might come out, who knows, maybe it'll come out in bits and pieces like today. I shared a little bit today, and I'll share a little bit in another stream. So anyway, thank you guys again for being here. And as we walk away from the stream, go do something healthy for your body that does so much for you. That's what I'm going to go do. I'm going to go for a walk. And thank you, Mary, for letting me know that you're still here. Appreciate seeing you again, and I'm glad you're getting back into the program. So until next time, everyone, get down on the floor and connect to your core. Take care.